Imagine this, you're in your 50s, you feel more tired than ever, your energy is down, your confidence is slipping, and your intimate life isn't what it used to be. But what if I told you that something as simple and natural as masturbation has been misunderstood for decades? Urologists around the world are now revealing secrets about this topic that most men, especially older men, wish they had known sooner. Today, we're going to uncover the myths, the science, and the shocking truths behind masturbation, testosterone, prostate health, and men's vitality. This isn't just about pleasure, it's about your health, your hormones, and your future as a man. Masturbation has been one of the most taboo topics in men's health. For generations, society, religion, and even poor medical education spread myths that it would cause blindness, weakness, low testosterone, or even infertility. Many men grew up with guilt and shame attached to something that was completely natural. Urologists, however, are now speaking up. Masturbation is neither as dangerous as some claimed, nor as harmless as many assume. The truth lies in understanding the balance. For older men especially, it plays a much bigger role than you might think in energy, hormones, and prostate function. One of the biggest myths men over 40 believe is that masturbation drastically lowers testosterone. Here's the reality. After ejaculation, there's a temporary dip in testosterone levels, but this usually recovers within 24 hours. Studies show that regular ejaculation, whether through sex or masturbation, doesn't cause long-term drops in testosterone. In fact, men who maintain healthy sexual activity tend to have more stable testosterone compared to those who abstain for long periods. The problem comes with excessive frequency. If a man masturbates compulsively, several times daily, it can disrupt dopamine pathways in the brain, leading to reduced motivation, fatigue, and even what some call flatline symptoms. For men over 50, testosterone naturally declines by about 1% each year. Masturbation alone won't destroy your levels, but how you manage it, along with diet, exercise, and sleep, determines whether you keep your masculine edge. This is where most older men regret not knowing the truth earlier. Urologists often stress one critical fact: regular ejaculation is linked to a lower risk of prostate cancer. A large Harvard study found that men who ejaculated 21 or more times per month had a 31% lower risk of developing prostate cancer compared to those who ejaculated less frequently. Why? Ejaculation helps flush out old prostate fluids, toxins, and potential cancer-causing substances. Think of it like changing the oil in your car. Letting fluid stagnate too long increases the risk of buildup and disease. Too much ejaculation, especially combined with poor lifestyle choices, can cause pelvic fatigue or irritation. But moderate, consistent release supports prostate health. Older men who went years thinking abstinence was healthy often regret it when prostate issues develop later in life. Here's where the science gets interesting. Masturbation affects not just hormones but also brain chemistry. Moderate sexual release boosts dopamine and oxytocin, giving men energy, better sleep, and even confidence. Too frequent masturbation, especially with pornography, overstimulates dopamine, leading to desensitization. That's why some men report brain fog, lack of drive, and erectile dysfunction after years of compulsive habits. For men past 50, energy is already precious. Masturbation in moderation can actually help improve sleep, regulate stress, and maintain healthy circulation. But abuse it, and you'll feel the opposite: drained, sluggish, and less masculine. Another overlooked area is the psychological effect. Many men carry decades of guilt around masturbation. This guilt, more than the act itself, harms mental and sexual health. Urologists emphasize, masturbation is not inherently bad. What matters is context. If it becomes compulsive, isolating, or tied to unrealistic pornography expectations, it destroys confidence and intimacy. But when approached with self-control and self-respect, it can be a healthy part of male sexuality, even improving confidence and performance with a partner. So, what's the takeaway so far? Masturbation is neither a miracle nor a monster. It won't rob you of your masculinity if practiced in balance, and in fact, it could save your prostate, regulate your hormones, and keep you vital longer than men who ignore or abuse it. But we've only scratched the surface. Next, we'll break down the myths one by one, dive into urologist case studies, and reveal the habits older men wish they had followed sooner. One of the most persistent myths men still believe is that masturbation causes erectile dysfunction. Urologists strongly disagree. Erectile dysfunction is usually linked to blood flow, cardiovascular health, diabetes, smoking, and low testosterone, not masturbation itself. In fact, moderate masturbation can help older men maintain penile health by encouraging blood circulation to the erectile tissues. Think of it like exercise for your arteries. If you never use it, blood flow weakens, and tissues can lose elasticity over time. However, there is a catch. Men who rely heavily on pornography and overstimulation often find real-life intimacy less exciting. This creates what's called porn-induced erectile dysfunction. The problem isn't masturbation itself, but the way the brain adapts to constant artificial novelty. Older men who consumed pornography excessively in their younger years often regret it, because they struggle with intimacy when they finally want a stable relationship. Another misconception is that masturbation weakens your body. For centuries, people believed it drained life force or caused weakness. But modern science shows the opposite. Moderate masturbation reduces stress, improves sleep quality, and even strengthens immunity. A German study found that ejaculation temporarily boosts white blood cells and immune response. For older men, immunity is critical, and small habits like this can play a role. Of course, balance is everything. Chronic overuse can cause fatigue, irritability, and even reduced motivation, not because of the act itself, but because of dopamine imbalance. Urologists often compare masturbation to exercise. Too little, and the system becomes stagnant; too much, and you burn yourself out. Men who abstain completely may face prostate risks and psychological tension. Men who overindulge face hormonal crashes and performance problems. The healthiest men learn control and moderation, using it as a tool rather than an addiction. One area most older men regret ignoring is pelvic floor health. Every ejaculation involves the pelvic floor muscles, which control urination, erections, and bladder health. Urologists now recommend Kegel exercises for men, not just women, to strengthen these muscles. Men who masturbated consciously and trained their pelvic muscles often report stronger erections, better bladder control, and more satisfying intimacy even into their 60s and 70s. Those who ignored this connection sometimes face incontinence and erectile issues earlier than expected. Now let's talk about relationships. Many men in long-term marriages secretly worry that masturbation harms their bond. The truth is nuanced. Masturbation in moderation doesn't damage relationships. In fact, it can help men release stress when their partner isn't available or interested. The danger comes when it replaces intimacy instead of supplementing it. Older men who hid secret habits often admit later that they should have communicated openly with their partners. Couples who spoke honestly about sexual needs, including masturbation, often had stronger bonds than those who let shame and secrecy erode trust. Another overlooked factor is testosterone rhythms. Studies show that men experience natural testosterone peaks in the morning. Masturbating during these peaks can actually feel more energizing, while frequent late-night sessions may leave men drained and sleepless. Many older men regret falling into patterns of late-night habits that disrupted sleep cycles and left them exhausted the next day. Urologists recommend being mindful of timing, using it to enhance energy, not sabotage it. So what does healthy moderation actually mean? Urologists suggest that for most men, especially those over 50, ejaculating 2 to 4 times per week is a balanced range. This supports prostate health, keeps blood flow active, and avoids dopamine burnout. Some men may naturally feel better with less, others with more, but consistency matters more than frequency. The goal isn't abstinence or indulgence, it's balance. We've now debunked the biggest myths. Masturbation doesn't cause blindness, doesn't permanently lower testosterone, and doesn't automatically ruin relationships. Instead, it's about context. The older men who look back with regret are usually those who either repressed themselves entirely or lost control to addiction. Those who practiced self-awareness, balance, and respect for their own bodies tend to age with more vitality, healthier prostates, and greater confidence. But there's one more area that often surprises men: the link between masturbation and mental health. Dopamine and serotonin released after orgasm can temporarily ease anxiety and improve mood. For men over 50, dealing with stress from career, health, or family, this can be a valuable release. However, those who rely on it as their only stress relief tool risk falling into dependency. Urologists emphasize building a toolkit: exercise, diet, social connection, and yes, moderate masturbation as part of a healthy balance. In short, masturbation is not your enemy. It is a tool, one that can protect your prostate, support your testosterone, and even sharpen your confidence if used wisely. But like any tool, misuse brings consequences. The men who age the best are not those who deny themselves completely or indulge without control, but those who understand the balance and respect their own bodies. So, if you're a man over 50 listening to this, remember, masturbation isn't about shame or secrecy. It's about health, science, and balance. Don't let old myths guide your life. Instead, follow the evidence, listen to your body, and apply moderation. That's what urologists wish every man knew sooner. Here's a powerful truth most men discover too late: masturbation is not just a private habit, it's a reflection of overall lifestyle choices. Urologists stress that how you approach this part of your health often mirrors how you treat your body in general. Men who eat poorly, avoid exercise, and use masturbation only as a form of quick escape often face greater regrets later in life. Meanwhile, men who combine moderation with good nutrition, fitness, and mental discipline tend to report higher satisfaction, even in their 60s and 70s. One area where older men often express regret is ignoring how hydration and diet affect sexual health. Erections depend heavily on blood flow, and blood flow depends on vascular health. Masturbation itself doesn't damage blood vessels, but poor lifestyle does. Men who smoked heavily, consumed excess alcohol, or ate processed foods discovered their erections weakened over time, and masturbation couldn't fix that. Urologists emphasize this lesson: masturbation is only one factor. Without proper sleep, exercise, and diet, even moderation won't prevent age-related decline. Another surprising discovery is how stress influences the experience. Chronic stress raises cortisol, which lowers testosterone and reduces libido. Men under constant pressure often report turning to masturbation for relief, but this creates a cycle. Instead of reducing stress long-term, it becomes a temporary bandage. Older men who never learned healthier coping strategies, like meditation or exercise, often regret depending too much on this one outlet. The healthier choice, experts explain, is to diversify stress management. Masturbation can be a helpful tool, but not the only tool. Now let's address one of the most sensitive topics: guilt and shame. Many men, especially from older generations, were taught that masturbation was dirty or immoral. Decades later, some of these men still carry guilt that affects their self-esteem. Urologists stress that this guilt is unnecessary. The science is clear: masturbation is a normal biological process. Holding on to shame only damages mental health. Men who learn to view it with balance and acceptance, rather than secrecy or fear, usually live longer, happier lives. Unfortunately, many older men regret wasting years in silence instead of educating themselves earlier. But there's also a flip side. Some men go too far in the other direction, using masturbation as an escape from real challenges. For example, avoiding social interaction, neglecting intimacy with a partner, or replacing ambition with constant self-gratification. These men often look back with disappointment, realizing that what began as stress relief became avoidance. Their regrets are not about masturbation itself, but about opportunities they missed in life while hiding in the comfort of it. Urologists emphasize this: balance means using masturbation as a tool for health, not as a substitute for living. There's also an important medical aspect many men ignore: prostate health. Research shows that regular ejaculation, whether from sex or masturbation, lowers the risk of prostate cancer. A landmark Harvard study followed thousands of men and found that those who ejaculated 21 or more times per month had a lower risk of prostate cancer than those who did so less often. Older men who denied themselves for years sometimes regret not knowing this. They thought abstinence was healthier, but the opposite may be true. The prostate benefits from release, and urologists often encourage men not to suppress this natural function. So how should men over 50 approach masturbation wisely? First, they should pay attention to frequency. As mentioned before, 2 to 4 times per week is a healthy guideline for most. Second, they should focus on quality, not just quantity. Rushing through in secrecy can reinforce bad habits. Instead, practicing awareness, relaxation, and even pelvic floor exercises during masturbation can make the experience healthier and more beneficial. Third, they should avoid over-reliance on pornography. While occasional visual stimulation is normal, constant porn use reshapes the brain's reward system, making real intimacy less fulfilling. Men who recognized this early and limited their porn intake often enjoy stronger relationships and better performance later in life. Finally, one of the greatest lessons from older men is this: masturbation should never replace human connection. While it's an important part of male health, true fulfillment comes from intimacy, companionship, and emotional bonding. The men who lived with the fewest regrets are those who treated masturbation as a supplement, not a substitute. They maintained healthy marriages, meaningful relationships, and open communication about sexual needs. Those who hid behind secrecy, addiction, or avoidance often faced loneliness later in life. In conclusion, masturbation is not something to fear, deny, or overindulge in. It is a tool, powerful, natural, and beneficial when used in moderation. Urologists want men, especially those over 50, to understand that the real danger isn't the act itself, but the extremes, either complete suppression or uncontrolled addiction. The men who balance this habit with exercise, proper diet, open communication, and self-discipline often report greater vitality, fewer regrets, and stronger confidence as they age. So if you're listening to this now, don't wait until it's too late. Learn the lessons older men wish they had known. Use masturbation as a healthy part of your routine, not as a crutch, and remember that balance, not excess, not denial, is the secret to lasting energy, performance, and vitality. Your body, your prostate, and your future self will thank you.